Hello and welcome to healthyconsumer.com Integrative Health Interviews. I'm your host Chris Sovey, and I'm here with Dr. Pete Kittle. And we're gonna talk to him a little bit today and get to know him, and he can hopefully shed some light on chiropractic care and help you understand some things that you might not be familiar with. So I'm going to start off telling you a little bit about his background. He is the founder of Chiro-technology Spinal Health Center in Holt, Michigan. He got his Doctor of Chiropractic degree at Palmer College. He's a certified sports physician from the National University of Health Science, and he's a certified rehab physician from Palmer College as well. He's also a certified personal trainer from the National Academy of Sports Medicine, and he's presently pursuing a certification as a wellness physician. Anything else I missed there with the...
My wife says I'm a professional student, so I can sort of see that. There might be a couple more, but I really don't care.
Yeah, we got alphabet soup going on here. Well, that's good. But he's also author of a self-published ebook called Fibromyalgia: Mechanism, Management, and Relief. And we will talk a little bit about that today. But first, let's kind of start off getting to know you a little bit.
Sure.
Dr. Kittle, and talk about, first let's start where you're at today. You're running your practice right now, right. And it's become very successful as I understand, and how did you get to that point? How have you been able to be so successful in your practice?
Well, I think the key to that is a two-part. Number one, we've always been on top of the most recent scientific information, therapies, techniques, which I pride myself on doing. But also equal to that is we really provide a great environment. I mean, our staff really cares about our people. You get personal attention. So I think it's that combination. In fact, I used to have a little saying back in the 80s. It was state-of-the-art technology with a personal touch.
Well, I've seen that too. I've been to his office, and everybody I've seen has received great care. So I can vouch for that as well. Let's go back a little bit and talk about beforehand. Talk about kind of growing up. Did you know that you always wanted to go into chiropractic care, or tell me, was there anything before that? Was it always, what is it?
Oh, lots of things before that. I was one of those people that got excited about many things and went through many changes. And in fact, I didn't even know what a chiropractor was until probably the 70s. As a child growing up, I was always interested in science, though. I was just a science nut. All my little science teachers, and even junior high, we had it set up. I'd come afterwards and they would teach me about antimatter, and we'd get into these really high-level college studies when I was in junior high, and I had some great mentors, some great science teachers back there. But I always knew it was going to be something in science or actually in music. Music is my other love. So I knew it was either going to be in science or music. In fact, a funny story, when I first started college, I was trying to decide if I wanted to be an atomic physicist or a professional bassoonist.
A professional bassoonist?
Yeah, so one of those. And I actually started out in music, which was my love, but then one day I cognited, gee, I'm going to be here for 8 years and not have a job. So one of my science professors said, you are so good at science, you should go into medicine, which then I switched from music over to biochemistry. I was actually going to become a medical doctor, but then I met my now wife, Kathy, and her father was a chiropractor. And I said, well, what is this chiropractic thing? It sounds kind of weird, and I always liked weird things like the bassoon. And,
yeah.
So that got me interested, and I really liked the philosophy. And otherwise, if I would not have met her, I probably would have been maybe a neurosurgeon.
A neurosurgeon, okay.
Yeah.
So if you would have went into traditional medicine, that would have been your route, you're thinking?
Yeah, I think so. I love neurology.
Okay. And then do you incorporate that into your practice as well, your love for that, or is it...
Oh yeah, because that's...
Do they connect?
Because in chiropractic, it's a real nice combination. It's a science and an art. So it's both. You get to use your brain, but you also use your hands to create. So it's like that double brain thing. I get to do both. I get to use my mind, but I also get to use my talents and skills on a mechanical basis. I think it's a perfect union.
Okay. Well, let's assume that the people that are listening to this have no idea what chiropractic care is. Maybe they've heard their friends talk about it a little bit, but they don't know anything. Let's take it from a beginner's level and just kind of tell the listeners what is chiropractic care and how did it get started?
Well, despite my many degrees and different studies, I still consider myself a chiropractic physician because based in the philosophy of chiropractic is something I really love, where traditional medicine, at least Western medicine in the United States, is based upon the fact that I'm going to fight disease. There's this disease process that's jumped on you,
right,
and I'm going to fight it. But the thing that intrigued me in chiropractic care was their philosophy is no, we want to create optimum health, and then you won't get sick in the first place.
Right.
And I think it's a huge difference. It seems slight, but it's a huge difference. To me, it's from a negative thing, attack this negative thing, and it turns it into this positive, wonderful thing of how healthy can I make you. And that's why I still consider myself a chiropractic physician, because of that difference in philosophy. Later, I know we don't have the capability right now. I do have a cute little graph that I made up.
We can post that in there, and it'll come up on your screen later.
But I'll talk a little bit about it. That I have a little graph where I have optimum health or life is at the top of the graph, and death is at the bottom. Now, most people in America are, I'll be kind and say halfway in between. It's probably worse than that. So they're trotting along at this middle line, and then let's say they get a cold, they get sick, so they go down a little bit, then they take a pill and they come back up, but they're still only halfway. The chiropractic philosophy is you come to me and you've got this condition, I bring you back to that level, but then we work to bring you way up to the optimum that you can have, which is different with different people based upon genetics and stuff, to the optimum that you can be, with the idea that you won't keep getting sick all the time.
Right.
So I just love that. That's just a great concept, that's why I consider myself a chiropractor still.
And one of the things that I've noticed about Dr. Kittle is he really takes the integrative approach. He works with other professions as well, and that's allowed him to get to the best patient health outcomes, which really sets him apart from some of the different people out there. And I think as a result, would you agree that chiropractic care in some aspects has got a negative view by some people because there are practitioners out there that aren't approaching it the way that you are?
Right. I've always been into an integrative medicine model. Everybody works together to achieve that optimum health.
Right.
So I work with rheumatologists, surgeons. I have referrals from surgeons, rheumatologists, family doctors. We all work together. Our goal is to make them as healthy as possible. Now, I kind of dodged your question a little bit, so I want to go back to the basic premise of chiropractic. So back in the early days, the late 1800s, D.D. Palmer came up with the idea of that the body is designed to be healthy. That's its normal state. And that also the brain and the spinal cords and the nerves that go to every part of your body are the things that control and mediate that. So if everything's working fine, your body should be able to heal itself, maintain itself, and not get sick. And his theory was when you get compression of the nerves, that, let's say, going to the heart, and then you're not getting that control, then the person gets sick. So what he says, if you can keep the nervous system operating at 100%, then your body will stay healthy because that's its natural state. Again, we were talking about the difference. It's not like this thing has attacked you.
Right.
It's make the body function as it was designed, and then you're going to have optimum health and theoretically never get sick.
Right. And if a couple of things that he's been talking about here, if you're not familiar, that's kind of what our whole traditional medical system has been built on, attacking the germ. We really built upon this germ theory, which goes way back to Louis Pasteur and Andrew Becamp, and kind of looking at that germ versus, are we going to strengthen the host or are we going to attack the germ? And as we've seen with the rise of a lot of antibiotic resistant organisms and things like that, it's really not working. So it's great that we can work together and find people taking an integrative health approach here like Dr. Kittle.
Well, exactly, because if you look at any situation, like if you're in an office situation, the same little beastie bacteria around it, yeah, the guy over there never gets sick, and this person over here is sick every week. The environment's the same. It's the same germs. So what's happening? It's the inability of the body to regulate itself and fight off. So that's why I say strengthen the body so you can handle anything. Give an antibiotic, yeah, it brings you up to that mid-range again, but then you're not any stronger. The next one comes around, you're sick again.
Right, absolutely. Now, how far can chiropractic care go? I see a lot of different people all over the spectrum on this, and this is not by any means meant to belittle anything with chiropractic care. I just want to get your professional opinion. I've noticed some people have made some pretty bold claims as far as being able to kind of reverse cancer, things like that. Where do you draw the line with that? I mean, you can have great outcomes with chiropractic care, of course. Where do we draw the line, and what do you recommend for people as far as when they're concerned that they might have a very serious condition? How do you take the approach on that?
Well, as I said, I'm very integrated. I work with all the specialists, and we work together.
Yeah.
There are actually 3 different philosophies, if I may, in chiropractic, of different philosophies of healing. You have the very, very conservative group, and they're like only chiropractic, and that's it.
Right.
Then you have the middle of the road people, and then you have what I belong to, which is everybody works together. So for example, you come to me and you have pneumonia. I'm going to say, go get on an antibiotic, but I'm also going to work with making your lungs work properly and your ribs work properly, and try to work with you so you don't get it again 6 months from now. I heard an analogy once that I thought was kind of interesting. They said, your house is on fire, and the invasive medicine would be like the firefighters coming, and they're hosing it down, but they're actually creating damage. I mean, they're flooding everything, but they put out the fire. Then you have the remodelers that come in afterwards and build it back up. Well, obviously, when your house is burning down, the remodelers aren't going to help you.
Yeah.
You need to get in there, and you need to get it under control. But then the difference is afterwards, you need to bring the people in, strengthen, rehab, get you healthy so that it doesn't happen again. So I think that's the perfect marriage. I just think we both need to work together.
Right, absolutely. And, you know, the approach that he's talking about here is wonderful. I don't want anyone to think that we're bashing traditional medicine by any means, but taking the least invasive approach, starting off conservative, can sometimes be the best for you. Of course, you need to talk to your healthcare professional and things like that. But it's a really good approach to start like this.
Well, if I could, Chris, one great example is one of my specialties, though I change every few years, is treatment, non-surgical treatment of disc herniations or slipped disc. I work with a lot of surgeons that do wonderful work, but I use a method of a specific 3-dimensional traction. We get like 98% of these well without surgery. Now, sometimes you need surgery, but my approach is do the more conservative first.
Right.
And if it works, we're happy. If it doesn't work, then I'll work with the surgeon to have the surgery. Again, it's that working together. It's not just me or you. It's like, how can we work together to make this happen? In fact, I had a working relationship with an orthopedic surgeon back when I was first in practice. And what he would do, he would get people, they come in with disc herniations, he'd send them to me, and we would do like a 3-week trial. And if I got them better, then we're fine. If I didn't, I'd send it back to him for the surgery. And he jokingly calls me up one day and he says, we have to rethink this arrangement. You're getting everybody well. And he was totally joking. He was a wonderful man. He's moved to Texas now, but that was I think that's the way it really should work, is working together when a certain procedure is applicable for the level you're at. I think that's what needs to be done.
Absolutely. And you know, that's what this website is all about, getting the information out there about all kinds of different treatments, helping to bring understanding between professions. I'm currently a physical therapy student, and I hear a lot of my professors kind of talking about this almost this battle between, there's a professional battle going on between physical therapy and chiropractic care, and we need to get over that. We need to kind of work together as much as possible.
I have several physical therapists that
Yeah.
I both refer to, and they refer to me.
Yeah.
With the disc herniations, for example, I'll come in, I'll do this 3-dimensional traction, we'll get the disc pulled back, but then they need to strengthen their core. So
Right.
I have physical therapists, they say, okay, then go see this person, because we want you, again, optimum health. We want your core muscles to be strengthened so you don't keep herniating those discs. So I think, again, it's a perfect marriage of care, and I have
Yeah.
several therapists I work with.
That's great. So it's kind of realigning these structures in a sense, in a very general sense, and then working with others to kind of maximize the
Right.
results that you
For
got. in your
stability.
treatment.
In fact,
Right.
there has been a lot of research out there that shows for acute care, you got a disc herniation, chiropractic care actually is the best for that. And then the same research says for continued stability, the physical therapy
Right.
works better than the chiropractic.
Right.
So to me, it's like both are wonderful. You just have to apply them at the particular time during that process.
Right. Right. Absolutely. Well, let's talk a little bit more about your specialties. As I mentioned at the beginning of this, Dr. Kittle's written an ebook called Fibromyalgia. And let me get the title here: Mechanism, Management, and Relief. You can find that at fibromyalgiabodypain.com. And I'm going to put that across the screen for you as well.
In big letters, right?
Big letters, huge. It's going to take up the whole screen. Along with his business in Holt, if you are looking for a chiropractor in Michigan. We're in central Michigan right now. It's Chiro-technology.com. And I'll put that across the screen as well. It has a dash in the middle
That's
there.
a dash. I was going to say, make sure
Yeah.
it's
Did you have
Dash,
trouble
check
getting?
now.
Did somebody already have Chiro-technology?
Some person in China.
Yeah.
And it wasn't even a chiropractic thing. It was some sort of chemistry or it wasn't even chiropractic.
Like chiromolecules or something.
Yeah, because
like
there actually is a thing. Chiro-technology also is a term that deals with like isomers and
Yeah,
something like
that's what
that.
I was thinking of.
So
Yeah.
it's kind of interesting. So it's a different thing. But yeah, someone in China had that.
Oh, bummer. Well, let's talk a little bit. Let's talk a little bit about your book here.
Okay, sure.
You feel comfortable about talking about that?
Sure.
The fibromyalgia book. Now we're going to focus in on this a little bit because it's a commonly misunderstood disorder. From what I've read, and there's a lot of people out there that may have it. But let's talk about it from a very basic perspective. What is fibromyalgia?
Well, first I would say I got interested in fibromyalgia way back in the early 80s. In fact, in my book I say I've been treating fibromyalgia for longer than it's had its name, which is really true. Actually, I missed it by 2 years, but it used to be called fibrositis because people would get this intense, non-remitting muscle pain all over their body, fatigue, debilitating, where they can't even get out of bed.
Yeah.
And originally they thought it was inflammation of the muscles or the connective tissue. They call it fibrositis.
Okay.
But then when they investigated it, it was not an inflammation, so that's when they renamed it fibromyalgia. The term myalgia means muscle pain.
Okay.
And but nobody really worked with it or understood it. I was so fortunate to hook up with a very excellent rheumatologist back in the area in the day that is world known. She's right here in town, but I'm not sure if I can mention her name, but we'll see. We should ask her first. But we ended up doing one of this integrative things. She would handle it medically, and then she'd send the fibromyalgia to me for all of the therapy. And it was a wonderful thing, and like I said, back then no one understood it. Most of the family doctors, I mean, they're busy doing other things. They didn't understand it. They didn't know what to do with it.
Right.
And so I've been able to help just hundreds of people with this debilitating muscle pain and fatigue over the years. Even now, it is better understood, but still now there's not a lot of people that deal with it. I had a lady, about 6 months ago that came to me and says, well, my doctor diagnosed me as this, but she didn't know what to do about it. I said, well, come on in. I have the whole program. Within 3 months, we had her doing great. The fatigue was gone. Now she's actually coaching a basketball team.
Oh, wow.
That was just wonderful to help her.
Yeah.
And she was out there lost going, well, what do I do? Nobody really understands this.
Right.
And I've been fortunate to, be able to understand this and work with this for years, and we have just excellent results.
I think there's a lot of different theories out there as far as what the cause of fibromyalgia is. What's your take on that? If someone coming at this from no medical background, what would you tell a patient as far as, are there a bunch of different factors coming together? Do you think it's one thing? Is it genetic? What's going on with that?
Well, you're right. Over the years, there's been many theories about what caused it. I believe I really have a handle on this, mainly due to our success in treating it. And it's a 2-part problem. The first part has to deal with the muscle itself. And we say it's caused by stress. And by stress, I'm not talking, emotional stress is part of that,
right,
but also environmental stress, toxins in the food, lack of movement. Stress causes people to tighten. If you've ever been in a stressful situation, all of a sudden your muscles tighten, your shoulders go up. Now, when you're on chronic stress, where that doesn't let up and you're in every day, the muscle contracts. Blood vessels go through the muscle so that it stops the flow of muscle. You get a buildup of these toxic byproducts, it irritates it more, and then the muscle becomes chronically tight. Now, after that, there actually are changes within the muscle where the nerves in the muscles then become hypersensitized. They start sending pain out all the time, and they go to the nerves in your spinal cord. Now, this has been well documented that in the spinal cord that there's changes. There's a thing called substance P that's released, and which means that whenever the muscle says, I have a pain that's mild, it goes to the central nervous system, it says, you've got a 10 out of 10 pain, which then makes you more stressful, which tightens up the muscle, which you get this vicious cycle over and over again, and it gets worse and worse and worse and worse.
Okay, so it's a vicious cycle, huh?
Right.
So if I were to come into you and said, oh, Dr. Kittle, I think I have fibromyalgia, how would you diagnose me?
Well, there are accepted diagnosis procedures. Now, first of all, fibromyalgia is a part of a continuum of muscle disorders. It's the last terminal, the last resort. It can start out with a regional pain where you have a chronic ongoing pain that doesn't stop in one area. Like some people have like lower back pain. The 2 most common spots I actually see are right in the shoulder blade, also in the upper neck by the top of the skull, and also in the lower back and around the little dimples in the lower back called the sacroiliac joint. So a lot of people have that in one area. In fibromyalgia, because it's progressing and getting worse, you actually get these non-stopped pain in all 4 quadrants of the body. So you have it in the spine, both arms, both legs, and usually are very fatigued, and that's the final blow. So we take a multi-level approach. Number 1 is nutrition. You've got to get the muscles relaxed. We've got to get the little energy-producing cells in the thing working. So we have actually special formulations of vitamins that will relax the muscle and also get the energy level up. Number 2, we work with many physical techniques like massage, acupressure, and things that will help to relieve the muscle pain and reduce the pain. We also work with the chiropractic, because again, we talked about the central nervous system is overreacting. So by reducing the irritation in the spine, that also sets that. So we can basically stop that cycle, reverse it, and the people get better and better and better. Exercise is a part of it, massage, adjusting, and in my book I have a whole several week plan. It takes you step by step. Number 1, do this. Number 2, do this. Number 3, do this. And we've had wonderful success with it.
Well, we're going to put that address across the screen here again about how, on average, how long does it take a patient to go through this process of recovery, or does it vary a lot? Or?
It varies a lot depending on how severe and how long they've had it. If the person's had it for 20 years and severe, they're obviously going to take longer than the person that's only been experiencing it for 6 months.
Yeah.
On average, we can get, I'd say, about a 50% reduction in pain in about 6 weeks.
Okay.
And
Okay.
that's an
Yeah.
average, and that's pretty good when
Yeah.
these people have this forever. It never will go away if you don't do anything.
Right. Now, from what I understand, there seems to be a little bit of a negative view, a stigma about this. Just people kind of telling it's the term used commonly is psychosomatic. It's kind of made up in your head or whatever.
Right.
And what do you say to people like that? How can we kind of get that out of that realm of, well, this is this fake disease that.
Yeah, and that's been a severe problem with people, because since it's caused by stress in the first place, then you go to your physician, they say it's all in your head, then you got more stress.
Right.
And with all respect to most of the family physicians, because they're trying to help, just like everybody else, but they just don't know.
Yeah.
And when you don't know, you tend to say, well, since I don't know, it must not be a real thing.
And they're just so busy too. I mean, it's almost like they want to, help, but they're just not really sure where to go from here. Correct?
Exactly. They're not the bad guys. They want to help as much as I do. But it's such a specialized thing. I've spent years and years and years and years studying it. They don't have time. They're dealing with all of these other things. So that's why I do have a great referral relationships with a lot of the physicians in the area. When they have this, they ship them over to me. I communicate with them, send them regular reports, and if they want to manage the medication, they can. But I usually recommend a rheumatologist, actually, because again, it's specialized.
Okay. All right. Well, it's that's a very interesting subject, and it kind of sets you apart from some other people. Is that one of your favorite things to treat in your practice, or what else do you really enjoy?
Well, I change. I'm sort of a strange guy. I get into things and I become proficient at it, and then I add that to my list and I go into something new. But I do really enjoy taking somebody with fibromyalgia, because it is so debilitating, and giving them their life back. I mean, that is a joy to me. Like I said, that's one we just had recently. I mean, she's back. She's coaching basketball. She has energy. She can do all this stuff. I love the results of that.
Yeah.
Because it's a difficult situation that's hard to manage. So I get my joy from taking these difficult cases and having them get their life back, and they're doing great. I don't know, that just gets me in the heart.
Oh, absolutely.